So the topic is acroplasmin in clinical practice. We now have experience using this over the past 4 or 5 months. And really the title should be how and who to use it on. There is a learning curve, and we're learning about thrombogenics. This is a great meeting this morning. There are 4 or 5 presentations on the use of acroplasmin in practice over the past 5 or 6 months. This is a new therapeutic class of drug. And so it's very exciting to see this early information coming out. We're going to see more exciting information, potentially from some other drugs that relate to this class of treatment. The label is broad. We've talked about symptomatic vitreomacular adhesion or vitreomacular traction, and that's all you need, at least for the labeling in the United States. So if you see a patient who has adhesion to the fovea and you see cystic changes or you see schisis, or if you see disruption of the photoreceptors, that's a sign of traction. The study looked at a wide range of patients. They had a wide variety of disease. It included macular holes. It included vitreomacular traction. It hoped to include only patients with 1,500 microns of adhesion, but there were actually patients in there that had more than 1,500 microns of adhesion. And in addition, there were patients who had epiretinal membrane. So therefore, we can expect from a clinical trial that we would see a varying response to different patient phenotypes. In addition, there's minimal data in off-label areas of interest. And when I talk about off-label, I'm talking about those diseases that can be associated with vitreomacular adhesion, which include diabetic retinopathy and age-related macular degeneration. What's important to realize is that it's very important to note what your early experience is with treating with these variety of drugs that we're using. And we're used to anti-VEGFs, where we have a very good response. Within 1, 2, or 3 injections, we see a response, not necessarily seeing a great visual acuity response in all patients, but we do see an endpoint where there's a significant resolution of fluid in greater than 80% of patients.